Can I treat eye bags with cosmetic filler instead of surgery?
Under-eye filler has become a popular and convenient way to help improve the appearance of under-eye bags. Filler placement under the eyes requires no surgery and can be performed in minutes to help camouflage under-eye bags. This procedure can be performed with minimal to no bruising. It is important to understand that under-eye filler cannot be used in all cases of under-eye bags and that surgery is often the better option. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. As a cosmetic eyelid surgery specialist, I perform a wide range of eyelid procedures every day, such as surgery for under-eye bags, treatment of upper eyelid hooding, and Asian double eyelid surgery. In addition, I perform oculoplastic specialty procedures such as eyelid ptosis correction, orbital and lacrimal surgery. I'm also well known for my work with injectable fillers for the face, particularly in the eye area, cheeks, chin, jawline, and forehead. Unlike physicians who cannot perform surgery, I am not limited or biased in treating the under-eye area with any one modality. Many people with under-eye bags are relatively young and often hesitant to consider surgery, preferring to have under-eye area treated with filler. While eye bags can occur and become more prominent due to age, they are mostly caused by genetic factors and can occur as early as during the teen years and in some cases even younger. So what are eye bags? Eye bags are caused by fat. Fat that is normally surrounding the eye can push forward like a hernia. This is why the fat that causes eye bags is referred to as herniated fat. Fat herniation under the eyes is referred to as lower eyelid fat prolapse. During consultation, I look at the prominence of the fat and the relationship of the herniated fat to the surrounding bone structure. For example, there is an area below the under-eye bag referred to as the tear trough. I look to see if the puffiness can be blended with filler in the tear trough. Generally, I use soft tissue fillers such as Restylane or Juvederm in this area as long as the under-eye bags aren't too prominent. It's important to understand that fillers improve the appearance of eye bags not by reducing projection, but by adding projection to the adjacent areas. In some situations where the bags are too prominent for optimal blending, I perform this procedure as a solution for people who want to look better in the short term and who will undergo surgery later on. If the under-eye bag projection is past a certain limit, as in the case of more prominent or severe eye bags, then adding additional volume may not blend the contour of the eye bags and actually add more puffiness to this area, making the eye bags look even more prominent. When selecting a doctor, keep in mind that many doctors who are not surgeons will choose filler to treat all eye bag cases, which means in many situations the filler placement can result in bigger eye bags. When eye bags are past a certain level of projection, fillers are not appropriate and surgery is the treatment of choice. This surgery is referred to as lower eyelid blepharoplasty. There are two lower eyelid blepharoplasty techniques. One is called the transcutaneous approach, where an incision is made below the eyelashes to address the fat bags. The other approach is referred to as the transconjunctival approach, where the fat pockets are addressed from the inside of the eyelids. In practice, it is common for many doctors to perform the transcutaneous approach to remove eyelid skin in an attempt to reduce wrinkling. In almost all cases, I strongly advise that lower eyelid skin not be removed, as it can lead to complications such as rounding of the eyes or eye exposure from skin shortage known as lower eyelid retraction. Oftentimes, the inside of the eyelid is exposed and irritating and is due to the skin removal. This condition is referred to as an ectropion. My preferred method is a more specialized technique called transconjunctival blepharoplasty, where no external incision is made. I approach the fat pockets from the inside of the eyelid to sculpt the fat. Since no external incision is made, the results look natural, as if you never had eye bags. This method preserves the lower eyelid support structures since no skin is removed and the anatomy of the eyelid is not compromised by disruption of the muscular support. When performing eyelid surgery, I most often sculpt the fat to remove the bulge, but leave some fat behind to create a smooth contour in the lower eyelids and prevent the lower eyelids from looking hollow. Lower eyelid surgery is an art, and not all surgeries are performed the same way. Having this procedure done with no external incisions allows the results to appear natural, and preservation of the fat to prevent hollowed appearance provides for optimal outcomes when performed by experienced surgeons. Injectable fillers placed under the eyes is routinely performed with topical anesthetic to improve comfort during the procedure. Fillers like Restylane also contain some anesthetic, which additionally helps people feel more comfortable during the procedure. When I place fillers, I usually prefer instruments such as blunt-tipped cannulas instead of needles to reduce the risk of bruising afterwards. And further, it helps minimize swelling caused by repeated needle entry. Generally, there is minimal downtime, and I see the patient again in 2 weeks after the procedure to see how the filler has settled and if additional enhancement is needed. In my practice, eye bag surgery through the transconjunctival method is performed with local anesthesia with light sedation. I prefer local anesthesia with sedation for almost all my surgeries, as my patients are more comfortable and are able to avoid the recovery and side effects of general anesthesia. Consequently, my approach results in easier recovery and faster healing after surgery. Surgery in my practice is performed in our own in-office surgical suite, certified by the Joint Commission for standards of safety and sterility. Patients routinely go home after surgery without any difficulty. As far as downtime, patients can return to work pretty much immediately after under-eye filler. In fact, many patients do it over their lunch hour and return to work immediately afterwards. There is the possibility of some bruising after the procedure, which typically fades in a few days. Routinely, lower eyelid surgery patients return to work in about a week. Interestingly, we have found that the limited bruising from lower eyelid surgery can be comparable to the bruising seen with the use of injectable fillers. Oftentimes, patients have much less bruising after my performing lower eyelid surgery than patients who have had filler procedures done elsewhere. The techniques I've developed over my career, combined with the systems for care and recovery, allow my patients to recover from lower eyelid surgery much faster than traditional surgery performed under general anesthesia. As part of the discussion about options, I discuss with my patients to look from a perspective of procedure longevity. Hyaluronic acid fillers, such as Restylane, can last 6 months to 1 year before being broken down by the body. The benefits of lower eyelid surgery can last for many years. Once fat pockets are removed, those specific fat pockets cannot come back. While there is a chance that other fat pockets can prolapse forward, the eyelid appearance can be stable for many years. Neither fillers nor lower eyelid surgery address skin quality, such as crepiness. Supplementary procedures for eyelid skin rejuvenation treatments, such as laser resurfacing, radiofrequency, platelet-rich plasma, may be considered to address crepey skin, pigmentation, and wrinkles. If you want to look good for an event, both filler and surgery can be performed on relatively short notice. I look at each individual situation and make recommendations based on my experience. Filler placement is a convenient option for limited eye bags with minimal to no recovery. Lower eyelid surgery is a more definitive procedure that can be performed for any degree of fat prolapse with results appearing as if you've never had eye bags or surgery. Patients often choose to have filler placement assuming they don't have time for surgical recovery. In our practice, applying modern, faster healing methods, recovery from eye bag surgery can be comparable to the time it takes for filler results to settle. Lower eyelid blepharoplasty really brightens up the whole face with minimal surgery. In fact, many patients who I've operated on comment on the ease of their experience with this procedure and state that if they had been previously aware of how easy it was, they would have done it sooner. I hope you found this information helpful. Thank you for your question.